Hey there everybody, it's Dr. Steve here with Kinesi, and here we're doing your Start Your Healing Now, what to do and where to start. And today we're talking about thoracic spine pain. This is part 2. In part 1 we went through a little bit of mobilizing your spine with the foam roller, and we played with vibrating foam roller, and then we did a little hands and knees, spinal mobility. So now we're going to kick it up a notch and we're going to do some even more direct thoracic spine mobility, and this is where using something like a post or a wall or something to have one hand out in front, and what that's going to do is that's going to fix and stabilize one side, while the other side we're going to swing and we're going to go through all 3 planes of motion, so that the swinging arm is creating a lot of motion, the stationary arm is creating that stability and fixing one side. So as the other side is moving, we're creating more motion kind of into the joint. So we're going to hit all 3 directions. So here I'll give you a couple of angles, but first we'll start with this direction, hand hanging on in front at about chest height. The other hand you're swinging down and swinging up. As the hand comes down, the body comes down. As the hand comes up, the body comes up a little bit. And so just going through a nice big comfortable range of motion. So to give you the visual of the back, if I'm facing this way, you can kind of see how much motion is happening in between my shoulder blades as we're going through those kinds of arm swings. So now we're going to go into the side to side. So here we're doing this side to side swing that I often call the rainbow wave, as the fingertips are tracing a rainbow arc, and you want to let the hips kind of get into it, a little bit of that sway side to side. So give you this other angle here. The arm is going up out to the side, fingertips tracing that rainbow arc, and the hips and the body get to sway along with it. So then we're going to go into our transverse plane, our rotation. So as the hand is fixed, we're doing a reach under and then opening up and back. So we're letting the whole body kind of turn with the motion down to the hips, the knees, the ankles, and the feet are getting to rotate a little bit. And you're following your hand with your eyes. So if I'm at the wall here, reaching under, reaching back, letting the head go with the hand. So that's one side, and then obviously we hit both sides. This one works out to be a really great 2-minute stretch little break. So if you've been sitting a lot, working at the computer, you can take 2 minutes to do a little self-care, a little self-love, and the 2 minutes works out to be, we have 3 directions. So if we do 20 seconds or about 10 reps up and down, 20 seconds or about 10 reps of the side to side, and 20 seconds or about 10 reps of the rotations. There you have one side, switch sides and repeat. And within 2 minutes, you get a lot done. You get the ribs going, you get your breath going, you get the whole chest opened up and blood flow through everything. And so we're getting that upper back, that thoracic spine that's been achy and painful, we're getting it moving and grooving, because remember, motion is lotion. And so we are here to help. And if you or anybody that you know are struggling with some thoracic spine pain, send them in, let us help. Let's figure out a way to get them some relief so that you can go back to doing the things that you love. Okay, until next time, we'll see you next, everybody. Bye-bye.